All right, and with that, let's transition into health information exchange. Again, starting with AHCA and getting the state perspective in kind of setting the landscape, what opportunities are there for providers to participate in HIE? Pam, you're incredibly well suited to answer this question. and again, I'm going to hit you with 3 or 4 questions in a row, and you've got to remember all of them. Do these opportunities vary based on whether or not a provider has an EHR already implemented? And then just kind of hypothetically speaking, if there's, a city, a region in Florida that, let's say they have 2 hospitals, they're unaffiliated, and there's a provider community, half of them have EMRs and half of them don't, and there's no HIE activity, what would your high-level playbook be for them to enable HIE connectivity, leveraging what's out there in the state?
Okay, I'll try to remember it all, I promise. As part of the outreach program for the Health Information Exchange program with the state, Secretary Dudick covered some of it. We do have several services that are available, and the whole intent of Health Information Exchange is for providers to be able to share information. So there is that interoperability issue between EHR systems that we are working through at the state level. And some of the services that we provide are intended to assist with that, to allow for that interoperability. We have our patient lookup service, and that is what people typically think of when they think of health information exchange. They think of what we are offering through our patient lookup service. It allows for participating entities to query each other for information. What's really cool about the Florida model, and that's my high-tech word for the day, cool, it probably dates me, but we have a federated model. In a lot of states, you will find that they have a centralized repository within their state. All the hospitals in the state share their information into this central repository, and then that information can be shared out with their participants. In Florida, we have a federated model which allows entities regionally that are connected or have a health information exchange system, or even hospital systems, to connect together using our service. So all of the information is not in this centralized repository. It stays with each of those participating entities. So it provides a little bit more security. Dawn mentioned that security piece, and I know they're going to talk a little bit about security in a minute on the next panel, but it allows for a little bit more security because it's within that particular entity. It's not all patient data is not all together, but it still allows for that interoperability. Right now we have 10 live participants, and typically when I say that people go 10, just 10, but that encompasses hospitals, ambulatory providers, home health care agencies. So we have around 500 entities participating in the patient lookup service. So it's a pretty good span. It's really interesting when I looked at Dr. Glissen's ACO map, because right now our HIE map kind of looks like the ACO map. So it was really interesting to me. We have the wide swath in the Central Florida area. We have the Strategic Health Intelligence over in the Pensacola area. And so it really kind of matched up. It was very interesting how those overlaid. I'll have to delve into that a little bit later. We also have our event notification service, which is awesome because it allows communication between hospitals and healthcare health plans. And we're really excited about that. That's one of the pieces when we talk about interoperability and care coordination. A lot of times the health plans kind of get left out of that. The payers kind of get left out of that conversation. And the health plans are doing a lot of care coordination right now. What is awesome about the event notification is if a patient goes into a hospital, they go to the emergency department or they are admitted into the hospital, and once they're discharged, an alert is sent to the payer, if they're participating, and it says, hey, your member was just in the emergency department. They were just discharged. They had heart palpitations. The health plan gets that information. Whoa, I'm going to send this information to the primary care provider. The primary care provider goes, wow, I just prescribed this medication. One of the side effects is it can cause heart palpitations. They need to be on a medication to solve something else, but I need to coordinate with them and follow back up with them and kind of closing that loop of information. So that's another exciting service that we have. And then, of course, for those providers that are not moving with the Jetsons yet, they don't have those EHR systems, they're still in paper format, there is a service called direct messaging. The state actually offers a direct messaging service that can be done through webmail. And a cool add-on with that direct messaging service is Strategic Health Intelligence, as one of our partners, actually offers what we call a hybrid query, hybrid patient lookup, where a physician can, whether they have an EHR system or not, can participate in that service and can query those systems that are on our patient lookup service, utilizing our patient lookup service. So they can actually, hey, I got notification from my health plan that this member went to the hospital. I'm using this hybrid PLU service. I'm going to query and get the CCD, the continuity of care document, for those of you that don't know that. I'm going to query and get that information so that I have it when my patient, I've of course gotten consent from my patient beforehand, and so I'm going to query, get that information so I can treat my patient with all the information that I can have. So it's really kind of cool how the services work together to help bridge that interoperability gap. And one of the things that we are really kind of focusing with HIE this year is the individual providers, the physician, those practice offices. We've gotten, a good number of hospital systems that are participating on the Florida HIE, and we want to make sure that those providers, the practices that are working with those entities or not affiliated maybe with a hospital, but have patients that are going to those hospital systems, that they can get that information, whether it's through this hybrid service offered by Strategic Health Intelligence, whether it is through one of our what we call open nodes, and those Kim mentioned earlier, Tampa Bay HIE, Community Health IT Now, and Strategic Health Intelligence all offer the capability of providers coming on and joining their HIE services so that they can get information from those participating hospitals. I think I've put everybody to sleep now, so maybe somebody else can.
Yeah, I'd love to get Don's perspective again. Both in terms of attempting to establish bidirectional exchange between a hospital and its referral network, and then also, do you do anything with telehealth? There's a lot of rural areas around here, so is that something y'all have tried to undertake as well?
Sure. Yeah, I'll talk about both of those. We're in the beginning stages of really kind of build, in a sense, HIE within this region. So we had formerly the Big Bend RIA, which was here, and we still have the remnants of that, where we do share through a local vendor here and sharing data within our referral partners. And so we're still participating in that. The challenge for us has been, we've been internally first been wanting to share and connect and do the bidirectional with other providers in the area. Sometimes the requests are, and our end goal is, what we want to do is, how do we keep the physician in their primary EMR and see all the data from one source and in one place? Right now, there's baby steps we're taking as we go through, but a lot of times if you want data from external sources, you're going to have to go to a third-party website or so forth to log in, and that's how our current HIE is working within this area. So you go to the third-party website, look up the patient information. So my envision and goal is keep the physician as efficient as possible, provider, in their EMR with seeing the data. Well, the issue is not all the EMRs have the capability to be able to pull in data from another system and put it and view it within their EMR. And so we're kind of handicapped by the EMRs themselves right now as they build that technology into their system, being able to share that data discreetly. A lot of times we can share what's called a CCD, continuity of care document. And basically it's a document of the last visit, all the information about the patient, their stay, and some notes and stuff like that. And sometimes that comes across as a PDF. Well, the physician only needs one piece of data out of this 4, 5, 10-page PDF. And so sometimes physicians, they're efficient. I want to take care of this patient. Now you're asking me to go scroll through this entire PDF to find this one piece of data. And our goal is, how can I get that one piece of data out where it gets right into the face of the physician? This is what I look for on a day-to-day basis with my patients that come in. These are the common things I look for. How can I get those right to the front without having to go hunt and search for them as we go through? So those are some of the challenges that we're facing. And as we build, we're also, just trying to really, the technical piece, technology makes our lives easier, right? It's supposed to. And so sometimes it is a struggle just trying to get data from point A to point B and be able to be seen. And sometimes you think it's very easy. And so that's what our struggle. From a telehealth perspective, telehealth is exciting for me. Because, I think of Dick Tracy watches, they have those now, and you can have video and all those things. So, hey, doc, yeah, let me send you my vitals right now and how I'm doing, eventually where we're going. Telehealth, we started telehealth, we had an initiative between the emergency departments, between the regional hospitals here, to be able to share back and forth. And we started doing virtual consults out in Perry, which is to the east of us. Where we can have patients there go to a practice and talk to a physician back here in Tallahassee, back and forth through video. And we have stethoscopes and all the glucometers and all the other stuff, and pulse oximeters, cameras that can get really close and really see detail, and those type of things. So it saves the trip for the patient. So instead of an hour drive from Perry here, then sit and wait, see the physician, and then have to drive back, now they can go locally, talk to a physician back and forth. And so those are things, we're trying to expand that, but right now we're funding that through grants and different things for that, for the payer side of that, and trying to really get that caught on and move forward with that. So that's an exciting thing that we're trying to do, expand our reach and to provide services. Eventually I see it as you're sitting at home. That's my vision. Why even have to go to a physician's practice where I can sit at home and see a physician from at home? But that's the future.
Mm-hmm. On the telehealth front, we've received several questions at the agency related to Medicaid reimbursement for telehealth. And so I just wanted to clarify that Medicaid can reimburse for telehealth. The majority of Floridians now are in managed care plans, and managed care plans aren't restricted from paying for telehealth. They have a lot more flexibility in managed care than some of the structured ways that we could pay for services under straight fee-for-service Medicaid. And managed care plans we expect them to be looking for quality ways to deliver services. If you are interested in working on telehealth models with your managed care plan, if you're in a network, we encourage you to help them understand how it can provide quality to the patients that you serve, how perhaps you're able to see the patient more often because you're more accessible with telehealth. So this is definitely a growing area, but there aren't restrictions in reimbursement. If you are on the Medicaid fee-for-service side, we do have a small amount of Floridians that are still in the fee-for-service world. Telehealth is reimbursable under physician services and under certain behavioral health programs. So we have actually a one-pager on that available at the agency. I've talked to Medicaid about putting it online so that it's more accessible as well.
That's fantastic. Oh, Pam, did you have something else?
Well, I was gonna ask Dawn a question. Can I do that? Am I allowed?
Yes, you certainly can.
So when you said that a lot of your telehealth that you're doing is funded by grants, is that because payers are not paying for? Okay.
That's correct. Our payers have not put in a model or a system for payment of telehealth services today.
Okay, so AHCA is at the forefront. Medicaid.
Well, and I think there's a distinction about reimbursing for the service
Service?
and providing the capital to get the program up and running.
There's-
So,
That's
you know,
right.
the Medicaid program isn't going to invest the capital, but they are going to reimburse for the service. So it still would require that you have the infrastructure in place. But grants is a great way to go. You know, perhaps there are some creative ways to work with other payers that have more flexibility in terms of startups as well.
And just from a state perspective too, I do represent the agency on the Florida Partnership for Telehealth. So there are meetings that take place throughout Florida. It is operated right now through the Southeastern Telehealth Resource Center. They operate out of Georgia. So it's Georgia, Florida, and Alabama, I think, that are in that group, in that partnership, and they are working to increase the use of telehealth in the state of Florida, working on some legislation that would solidify that, yes, telehealth is actually considered the practice of medicine, although there are no prohibitions to telehealth. So I just wanted to clarify that as well, legally.
And I mean, this is really phenomenal. I work with a lot of other states, and there are a lot of states where you can ask the AHCA and the state Medicaid department what's going on with telehealth, and you get nothing. Because a lot of other places, there's nobody willing to pay for it. There's nothing happening. So that, I mean, that's fantastic to hear. I mean, it's often overlooked, and that's going to drive down cost about as much as anything. So that's great. So now that we've got a good understanding of EHRs, HIEs, what's going on at both all the way from a hospital level to a state level, how is that playing into better tracking and improving population health? Starting with AHCA and DOH, what kind of collaboration is going on using analytics and outcomes to improve population health? Is there any overlap with the HIE?
I'm looking at that end of the
We'll
table.
let Tom go first. from a
Okay,
population
well,
health perspective.
when it comes to population health, public health, we're looking at the population, and that's everybody that's here in the state, and really looking at overall levels of wellness, trending disease, et cetera. What we've done over the years, we've implemented a number of things in terms of being able to consume data from different sources. We've been doing electronic lab reporting, results reporting, because lab's a sentinel event for disease outbreak, et cetera. So that's a real key event for us. We've been doing ELR since 2000, primarily working with the major lab companies and hospitals. In addition, of course, we have a communicable disease registry. We have the state immunization registry, and all of these have been up for 12 to 15 years. And also in the area of HIV care, more specialized care, of course, there's a number of different federal grants that are being monitored and managed throughout the state, and they're using a common system for that. There are a lot of data management challenges with that, but we've been in this environment for quite some time, and HIE just affords us another level where we can take this to the next. We can really move the game forward, because it really means, and like we were talking, in terms of EHRs, there's a lot of pieces that have to be in place. You've got to have ambulatory care is a huge component of it that we're really scratching the surface, and I applaud what we're doing with that now, because I think that's a strategy we have to have in place, and as we go down the road with these conversations, we should hear more and more about that. And so we're excited because it just opens us up. We're also do some genomic surveillance system called Essence, which we're pulling basically very simply diagnostic through text files. And you can identify, trending, in terms of symptomology, et cetera, across the state. So if we can open other avenues, and HIE opens those types of avenues to be able to more freely exchange that data, it certainly will be of great benefit to us. So we're very excited about it. So, certainly with HIE patient lookup, epidemiological case follow-up is something we can use the HIE for as we move down the line. We're in the process of getting that set up right now, and that will automate some of that process, so we don't have people copying tons of records for us in a hotel room in a hospital medical records room. I don't know where the hotel came from anyway, whatever. But in a down in some medical records back room, and you can automate that process and basically transfer that data and do those queries through the patient lookup function. So it affords a lot of opportunities. That's not even talking biometric trending, et cetera, which maybe way down the road in Jetson land.
From the agency's perspective, we're very focused on transparency. You heard the Secretary talk about Florida Health Finder, and hopefully if you're not familiar, you'll stop by the booth on the way out. But the Florida Health Finder website actually uses a lot of existing data, not EHR per se, but we do receive discharges from all hospitals every quarter. We receive information from ambulatory surgery centers, and we're basically quantifying that information and displaying it for consumers on our website now. So I would say multiple times a year, we're making enhancements to that site. We get a lot of feedback from consumers, from payers, from employers that are looking to purchase, in many cases, health insurance, but they want to know what provider networks look like. So we're constantly making changes to that site to improve the information that's available. Currently, you can see information about potentially preventable readmissions for hospitals. You can see volumes in terms of certain procedures, which physicians are performing certain numbers of knee replacements, et cetera. You can see infection rates, and you can see other information about complications. We also have a good bit of information about customer satisfaction. And it's not just hospitals and ambulatory surgery centers. We have hospice data. We have information about nursing homes. We're constantly trying to create ways for consumers to find this more digestible. So we're creating portals for consumers to come in and just look at everything we have about assisted living facilities. So they don't have to navigate through and go to one place for quality and another place for demographics. So we encourage you to use it. We encourage you to ask us what else could be enhanced. We have managed care plan information available. We have regulatory data, so not only can you find out how many beds a hospital has, what emergency services they provide, but also what their inspection history is like. What types of violations have they had? What types of fines have they had? We have in some cases where we've had to impose an emergency moratorium or suspension of a license, and that's there as well. So everything regulated by the Agency for Healthcare is there. And then we also link to Department of Health, which also has some information. I think in terms of kind of up and coming, I think we see the Commission on Healthcare and Hospital Funding that the Secretary mentioned, delving into greater opportunities to improve transparency, both in healthcare reimbursement and in hospitals. They're already, looking at things, not just, for example, preventable readmission rates or costs of care, but also the relationships between how much charity care a hospital is providing and their cost of care or their length of stay. So I think we're challenged to improve what's available and making sure, one of our jobs is to make sure that it's presented in a way that's helpful. So there is risk adjustment to a lot of the data that we provide, and we're trying to make sure that things are put out in a way that's consumable as well. Let's see. I think those were the biggest points, other than making sure that if you are interested in being more engaged in some of the things we're working on, we do have a lot of public meetings. We have a lot of work groups associated with this, so we encourage you to check out our Florida Health Information Network website. If you're interested in following the work of the Commission or in other activities about consumer information, we have a Consumer Health Advisory Council. The Commission meetings are publicized through the Florida Channel, and so there's a lot of ways to stay engaged in this and learn more as well.
Thank you. If you'll excuse my presumptiveness, I think I actually might be uniquely positioned to answer the last user-submitted question, and then I'll turn it over to y'all. I hope you'll understand why when I ask this. So the question is, how does Florida's HIE compare to other state HIEs, particularly in terms of services provided, customer recognized value, cost of services, and number of participants actively using? I think services provided, if you remember Dr. Glisson's slide that said, this is what people think of the Navy, this is what it was. I think PLU, the query model, is the essence of HIE. That's what everybody really thought of, that this would be the backbone of HIE. And so that very much is the backbone across all HIEs. That's the service that people started off with. And then it graduates into more value-added services. And I think that's where E&S comes into play. And as states are, as HIEs are maturing, as they're getting more free will to react to their markets and develop what really needs to be done, I think you're seeing folks coalesce to services like notification services and those value-add services. So I think there's a lot of uniformity in terms of where HIEs are gravitating towards with regards to the services offered. So it's pretty common, I think. The one thing that I think is really unique about the services that Florida offers, particularly in terms of patient lookup, is a lot of times we've heard a lot of people talk about mouse clicks and how long it takes to get somewhere. And the Florida HIE started with single sign-on integration for patient lookup, which that's kind of unheard of elsewhere. That's a couple steps down the road. And what that means is that nodes are able to access the data from within their EHRs. And even sometimes be given a heads up within their EHR that there's data out there available. Because oftentimes one thing you hear is if other HIEs will start off with a web-based portal and it's, well, I've got to go to this website, I've got to type in all this data, I don't even know if I'm going to find something when I query, and if I don't, well, that was just a waste of time. And this is taking all of that out of the equation by putting it in an EHR. Being able to give folks a heads up, and it's harder. The folks at Harris, I'm looking right at them. It's a lot more work to enable that single sign-on integration. But the fact that the Florida HIE and Patient Lookup was doing that at the outset is going to drive greater utilization down the road, because it's going to be easier to use. It's going to be in workflows, and some of those standard objections that folks have are not relevant. So I think that's a really cool thing that the Florida HIE has done that's different than the progression that a lot of HIEs take. Customer recognized value. I know I speak to the folks that use the event notification service every day, and it works. It's the real deal. People love it. People love it here. They love it elsewhere. So that's great to hear. I know, and I know people say the same thing about the patient lookup service. The cost of the services is actually, it's incredible how low how efficient the operating costs are for this versus other HIEs. And I'm not going to get into the numbers, but it's for a state this big, it's phenomenally efficient. How this HIE operates. Number of participants actively using, again, like Pam said, 10 nodes on patient lookup is very misleading, because those are big nodes with a lot of people, a lot of organizations underneath them. And when the hybrid services like Strategic Health Intelligence and Tampa Bay HIE, when those get off the ground and they start really, once the ambulatory community and the smaller doc practices get wind of that's just going to take off. So the amount of nodes really should be small. It should be a lot of people coalescing to a smaller amount of access points. That's more efficient. So I mean that's the way it should be. And it is. You also don't see states as big as Florida having statewide services like this. So the amount of users and the volume with Florida will be at the forefront of HIEs across the country, and it already is with ENS. ENS has been live for 3-4 months now, and there's no ENS, there's no notification service that's plugged into as many hospitals anywhere in the country. Again, Herculean effort on Harris's part to get those connected, and I've never seen a subscription base grow from 0 to 950,000 where we are now that quickly, and that's really and truly just the tip of the iceberg. So I think within the next year or so, you're going to see some volume metrics that are just out of sight in terms of both the services that the HIE uses. Does anybody have anything to add to that?
I'll just add, I mentioned early that we've had to be very flexible in how this program's rolled out in Florida. I don't think ENS was envisioned anywhere at the very beginning. It was not a service that we thought was even on the table or would be necessary. I think there was this hope that everyone would do the patient lookup right away, that there was all this value in it. It was the simple way to go, but adoption is slow sometimes. And so starting with kind of secure email and getting people used to that, one of the things that we've really tried to do at the agency is think beyond the scope of this one project. How can we leverage other things that we have our hands in to encourage participation. So the event notification service is a good example of that. So one of the things that we did in our Medicaid program is in our contracts with Medicaid managed care plans, we put standards in there that expect their provider networks to participate in electronic health records and electronic health exchange. At this point, it's a suggestion, it's an expectation, it's not an absolute mandate, but in introducing the idea that this is part of what we expect in Florida in terms of quality. And then actually tying participation in the low-income pool funding for hospitals to participation in the event notification service. So to continue to receive those state and federal dollars for hospitals, they had to participate in the event notification service. And it wasn't intended to be a stick approach. It was more, we see value in this, and there's a way to encourage it. Once it started, then I think people finding the value, plans seeing the value, wow, this can really help me in managing care. I don't have to wait until I get a bill for services at the hospital 30 to 45 days later to know that my patient was there and may need some follow-up. And it's a limited exchange. It's not a full health record, but it's enough for the payer to know there's something important there that may require my action. So I think having the engagement of partners, having the engagement of a lot of people in this room has really been important in helping identify what some of these opportunities are. And that's, we don't stop here. We've got a long way to go. So I think from that perspective, Florida has been really not unique. I'm sure other states are doing this too, but really trying to manage all those pieces together.
The only other thing that I would add is that one thing that is really unique about the Florida HIE is that it is paid for by the participants. There is no funding. There's no funding from the state. There is no grant funding that we are currently using. We did use grant funding to establish our infrastructure, but it now is operated by the participants. They're the ones paying for these services because they see value in the services being provided, in that patient lookup service, in that event notification service. And so I think that goes a long way to showing where Florida is, showing where providers and healthcare payers, providers, that whole healthcare continuum is in realizing the importance of health information exchange in this state.
So I have one more question before we wrap for this session, and it's, just looking ahead, I think this is always a good one to close on. If we were to do this exact same event, this exact same panel next year, what do you think the state of the state's going to be 12 months from now? Where do you think it's going? What do you hope is going on in terms of your respective organizations and priorities?
Well, I'm going to answer that by going back 4 years. And as Molly mentioned, this program looks totally different than when I started working on it 4 years ago. What we envisioned health information exchange being 4 years ago is not where we are today, but where we are today is a really cool place. And we are at this precipice of great things, I believe. We are at a place where I think the health information exchange is going to continue to develop and grow. I think with a little bit of pressure on some of the EHR vendors, we'll get some interoperability between providers, physician offices, getting some of that integration. I think in a year, we're going to see a big change. We're going to see a lot more interoperability. I think we're going to see a lot of providers moving towards using EHR systems if they are not already there. I think that within this year, with the focus on those primary care physicians, getting them integrated into EHR and to HIE, I think there's going to be a lot more coordination of care. And so I think a year from now, if we come back from a year to now, okay, somebody write it down so we can see who's closest. But I think that we're going to see a lot more of the individual provider practices. We have a lot of the hospitals sharing information now. I think we're going to see a lot of those providers, individual providers, sharing information between hospital systems, with the health plans that they work with for their patients, and the health plans members. I think there's going to be a lot more exchange. a lot more sharing, a lot more coordination of care. I think we're going to be moving closer to that Jetson picture where we have that coordination of care going in here in Florida. Tom
Okay.
goes, No.
No, absolutely. Well, my 2 cents, I mean, I always like to say whenever I talk about this, is, one thing we have to remember is, there are a lot of challenges here. I mean, we're truly in the pioneer days of IT technology and healthcare, health information exchange. We all have to be mindful that, and patient that there are going to be challenges, interoperability, adoption, acceptance. I mean, there are all kind of challenges to these things. And so, I mean, we're there. I mean, once you've jumped off the diving board, you're out there. So we've made a very important first step. Like Pam said, it's come a long way in the last 4 years. I think as we go forward, we really have to look at, the engagement of the ambulatory community. I mean, I think that's a big piece of this, and how we make it as transparent to their process and their means as we can. I think that's really important. Of course, that goes hand in hand with the EHR adoption, because you've got to have some way to communicate and actually share data and have a platform in which you do your own work in order for that to work, and have your little vehicle onto the highway, so to speak. So I think we've come a long way. I think challenges as we go forward really are looking at how we expand it into the ambulatory community. I know at HIMSS last year there was an ONC town hall, and ONC is the Office of National Coordination, who coordinate the whole EHR meaningful use program at the federal level, and the HIE pieces, all that. I still remember one physician got up who was from Bradenton, Florida, and said, well, HIE's come and gone in Florida, and we don't have anything. And that was his public comment to the ONC, and so we've still got doctors out there who, at least at that time, weren't even aware of what our efforts are at the state level and across the state. So I think we've really got to, make that doctor in Bradenton understand that we do have an HIE and it is out there, but we've got to be patient and keep our eyes on the prize. So, I mean, I think a year from now, we just have to stay committed to where we're trying to go with this and how to move it forward.
I want to look at it from a patient perspective, where everything's going from a technology. Technology changes by the minute. I mean, technology from now till next year is going to be it's going to change. But from an HIE's perspective, from a patient standpoint, you think of all the wearable devices that are out there today, and all the apps that are out there that are collecting data on each individual. All that's being pushed up to in the cloud, right? And all these portals that have all this data. Well, if you start feeding into the patient portals within your primary care practice, and then that data will be shared into the HIE. So now you start looking at the amount of data we're going to start collecting from each individual. Because, face it, you got the Fitbit, you got all these devices that you can buy anything attached to you and collect data at any given time. Your sleep habits, all that. So from that standpoint, I think in a year, we're going to start seeing a flood of the patient data coming from all these wearable devices into our patient portals and up into our HIEs. So now you're going to have a wealth of more information where you're tracking day to day. And some people may not choose not to be tracked day to day. With all the wellness programs that are out there and the incentives and the push for that to improve everyone's health. I mean, that's where I see things heading.
Excellent. Well, I'd love to next year hear Don and Dr. Glisson talk about the measurable outcomes that they've seen improve because of Health Exchange. I think, who knows? A year from now, things have changed so much. Since this program began, it's difficult to predict. I think, progress is great. But I think in the end, there is, people are waiting with bated breath to see how have we actually improved things? How have we changed? What, quantifiable information can we share about the improvement of electronic health record exchange? That would be my wish. Okay.
Excellent. Well, with that, I think we'll go ahead and wrap this one up. Thank you all very much. This was great panel, very insightful. Thank those of you that submitted questions as well. Those were great.